Now, the president of Guinea, Alpha Condé, has urged the people not to panic as his government deals with an outbreak of the deadly Ebola virus. The medical charity Médecins Sans Frontières says the country is facing an unprecedented epidemic of Ebola. So far, 78 have died from the disease in Guinea. It causes severe bleeding. The country has 122 cases of suspected Ebola since January. The strain can kill up to 90% of its victims who suffer extensive internal and external bleeding. Now, 4 deaths have been reported in neighbouring Liberia. Our global health reporter, Tulip Mazumda, has this update.
The epic task of containing this deadly virus continues. The medical charity Médecins Sans Frontières is describing the outbreak as an epidemic of a magnitude never before seen. That's because it's hit 5 areas of Guinea now, including the capital, Conakry, which has a population of 2 million. Medics treating Ebola patients are at high risk, so they wear protective gear. Just touching someone who's infected could pass on the virus.
We are facing an epidemic of the extent that has never been seen before, especially by the distribution of cases in the area. Other epidemics in the past have been much more concentrated than the one that we're currently confronted with. It makes our work much more difficult.
The virus, which kills up to 90% of those infected, has now spread to Liberia. There are 7 suspected cases and 4 deaths. At least 1 is confirmed to be from Ebola. Guinea's Ministry of Health, along with international partners, are now following 400 people who've been in contact with suspected cases. A key priority is to make sure they aren't continuing to spread the virus. It's a major concern Ebola has now reached the capital and neighbouring Liberia. But the country's president, Alpha Condé, has been urging people not to panic and says the authorities are doing all they can to end this deadly outbreak. Tulip Mazumda, BBC News.
Well, let's get some more on this. Anya Waltz is working with Médecins Sans Frontières in charge of the isolation procedures in Conakry and joins us now on the line. Anya, so the difficult thing about this is to isolate people who've got the virus and then try to work out who they've been in contact with.
The difficulty in the moment is the isolation was set up by the Ministry of Health, and it's really good. And in the moment we have 8 patients in the isolation, but the main issue is on one side, as we don't have any treatment for the patient, we already had yesterday 2 deaths and 1 death today. And the second one is really the contact tracing, that we can stop to find as soon as possible the suspected cases to bring them into isolation. But as we speak about the capital in Conakry, with 2 million persons, we try to organize it. We have really to try to organize to work with other organizations to get the suspected cases as soon as possible to isolation.
Anya Waltz from MSF.
Hello?
Yeah, thank you very much. Got to leave it there, Anya. The line is not great, but we did manage to catch what you said about the extremely worrying situation with this Ebola virus outbreak in Conakry in Guinea. Do stay watching us on World News Today. Still to come.